Can you explain a bit about your role as a CA at BBR?
So being a clinical assistant at BBR Optometry mainly involves being the first point of contact for the patient. So we are the member of staff who will greet them and lead them on their patient journey. We will complete the preliminary tests for the optometrist. So this will involve a pressure check, a visual fields test, and also if you have the extended examination, we will do a 200-degree retinal image of the back of the eye.
And what's the importance of all these procedures that you carry out?
So for the optometrist, one of the tests that we do, which is the pressure check, it's a really important bit of baseline data for them before the examination begins. So this will tell them what the patient's pressures are prior to dilation, or at least even before they'll put the drops in for dilation. We also do a visual fields test, which can pick up any visual field defects. And this will give the optometrist that bit of information so that they can then obviously look into that further with the patient.
And so how long does it take for an examination at BBR?
An examination will take, we would say, to allow at least an hour for your visit in total, 40 minutes of which will at least be with the optometrist if you have the extended examination, but we say allow at least an hour to be in the practice.
And can you explain a bit about the difference between an extended examination and an NHS test?
An extended examination is the equivalent of a private examination, but with that NHS contribution. So we offer the two levels. So a patient can have just an NHS examination, which will just cover the standard sort of appointment with the sight test. An extended examination will be a lot more in depth. It will involve more time with the optometrist. It will involve a scan, a really detailed scan of the back of the eye, looking at the three-dimensional images and layers of the retina, and will usually involve dilation. So that gives the optometrist a really good look at the back of the eye.
We do a lot of different dry eye treatments here. What's your role in helping people with that?
So with when a patient attends an appointment, we will usually ask a few questions involving the last 7 days, so how dry eye might have affected their day-to-day life, and then we will be the sort of contact point for the end of the appointment. So if the optometrist has determined that dry eye might be an issue for that patient, we will then discuss their treatment plan. So that might involve a therapeutic mask, which is usually heated and will involve a bit of massage of the lids, or we will discuss a drop as recommended by the optometrist, or we have that ability also to recommend drops because they're not prescription drops. They are just something that can be used to really give a soothing effect for the eye if that's present.
And as part of your varied role, you also teach people how to insert contact lenses.
So that will involve teaching that patient how to insert, remove and care for their contact lenses. So also building confidence so that they can take their lenses home and will be capable of removing them, putting them in the next day, and also just answering any questions that they might have on the care and being a point of contact as well. So when that patient goes home, if they've got a query, they can obviously have your name as a contact and give you a call if they have any questions on the care of the lenses.
And are they often initially nervous about wearing contact lenses?
Yeah, first-time wearers can be quite nervous. It is quite a big thing going near the eye, especially with your fingers. So the clinical assistant's role will be primarily giving that, boosting that confidence and encouraging that patient on how to get around that sort of strong lid reflex. So it's teaching them lid control and the best techniques.
What makes you proud to work at BBR?
Working for BBR Optometry, you can always feel proud in the fact that we always have up-to-date equipment. We're always fully trained on that equipment when it comes in. Our dispensing opticians are fully qualified and have degree standard qualifications. Our optometrists are incredible at what they do, and every member of staff is approachable and kind, and we all just work really well as a team.
Thank you.